And so now it's time to hear a little bit from me. I want to take a few minutes, if I may, to highlight the policy context that this learning aligns with, as it's really important in how we at the Trust influence and how you and other stakeholders shape the way in which you take the learning forward, also to make that change impact felt. So during this time of COVID-19, we are far more aware of the restrictions to our liberties and the justification of those restrictions to safeguard public health. The United Nations Convention on the Rights of Persons with Disabilities recognises that these liberties are often restricted or unsupported, especially for people living with dementia. There are three articles that I want to highlight that are pertinent to today's learning and the webinar that you're sharing with us today. And they're particularly relevant to our Get Outdoors theme. I'm going to quickly just talk about them. So I'll highlight them first of all. So Article 5 is about equality and non-discrimination. Article 8 focuses on awareness raising. Article 30 on participation in cultural life, recreation, leisure and sport. So let's look at Article 5, equality and discrimination. This article says that everyone is equal before and under the law. Everyone is entitled to the equal protection and benefit of the law without discrimination. Sometimes, in order to be equal, however, adjustments have to be made to help a person take part. These are called reasonable adjustments, and if we are serious about getting people with dementia outdoors, as the report has so brilliantly described, then we need to look at what these adjustments should be. All of the projects funded through Get Outdoors had to consider these adjustments, whether they be levelling of pathways, for example, better signage, or more places to rest when out walking. If we move on to Article 8, which talks about raising awareness about disabilities, it says, and I quote, countries must raise awareness of the rights, capabilities and contributions of people with disabilities. Countries must challenge stereotypes and prejudices relating to people with people with disabilities through campaigning, education, media and awareness raising programmes. Although this is directed as nation states who have signed the convention, it is our moral duty to raise awareness where we can about dementia and the outdoors. This is what these projects have done and will continue to do. And finally, moving on to Article 30, participation in cultural life, recreation, leisure and sport. Sadly, COVID has emphasised very clearly to each one of us the importance of these aspects of life. People are crying out for the opening of arts and sports venues, and drawing a strong correlation between the lack of these things and poor mental health. We must remember these thoughts and feelings as we emerge from COVID and ensure that we work extra hard to uphold the right of people with dementia to participate in activities that take them outdoors. The mental health of people with dementia matters just as much as the mental health of anyone. And so moving on to Scotland's policy drivers, what do they look like and how does the learning from Get Outdoors have any relevance or any impact? So there's four key areas that we would say needs to be drawn attention to in relation to the learning from today's event. The National Performance Framework Key Outcomes, the Health and Social Care Standards, the National Dementia Strategy, and the Dementia Recovery and Transition Plan, which was newly launched. So let's look at Scotland's national outcomes, which say that all citizens should be able to value, enjoy, protect and enhance their environment. People with dementia have an equal right to enjoy their outdoors environment as far as they can. In order to do this, they may need the support and encouragement of projects such as those that you've heard of today. It would also be true to say that Scotland's national dementia strategies don't give much consideration to the outdoors, which is disappointing given that we market our country as a land of mountains, lochs and wide outdoor space. We hope that the evidence from this learning event will demonstrate the importance of getting outdoors for people with dementia and their families and their friends, and the impact it has on their well-being, and also that people can access the outdoors with the right support despite the challenges that they may face. It'd be really good to see a reference to the importance of the outdoors in the next dementia strategy. And moving on more recently to the launch of Dementia and COVID-19, the Action Plan, which is more commonly known as the Dementia Recovery and Transition Plan. Again, this makes no specific mention to the outdoors. However, in Commitment 11, it says, working with local health and social care partnerships and the third sector, community groups and businesses, we will support and enhance local dementia-enabled communities and reduce social isolation and loneliness as part of our shared action to strengthen and recover resilience in our communities. And again, today's event will provide much needed evidence to ensure access to the outdoors is recognised as part of this shared action. There are other commitments, including those who reference rehabilitation, that will also connect well with the evidence being shared today. And finally, Scotland's health and social care standards. They make reference to the outdoors in numerous statements. For instance, in Standard 1.25, it says, I can choose to have an active life and participate in a range of recreational, social, creative, physical and learning activities every day, both indoors and outdoors. It is our experience that many care providers, whilst doing a superb job of assisting people to be outdoors informally and through planned activities, there is many more that can be done. Sometimes, though, we hear about care settings where people with dementia rarely feel the wind, the sun, or the rain, even though they would be capable of being outside. Standard 1.12 goes on to say, I am fully involved in assessing my emotional, psychological, social, and physical needs at an early stage, regularly, and when my needs change. Based on the evidence of the report we are considering today, and a wider range of evaluation evidence from the Life Changes Trust funded work, we would argue that any assessment should include a specific section on support to be outside on a regular basis and an exploration with the person on what they would like to do outdoors. We know that some care settings do this and do it well, but we know that many don't yet. And finally, Standard 2.22 states, I can maintain and develop my interests, activities, and what matters to me in my daily life. One of the key findings of this report is that people engage with new interests as well as maintaining previous interests in those that they've done before. People with dementia have as much right to develop and thrive as any one of us. A small change that increases social contacts or brings a person closer to nature, for example, or allows them to share a skill can greatly increase a sense of well-being. This benefits the person with dementia, but can also benefit those around them, as mentioned, family and friends. And so now moving on to how the Life Changes Trust uses its evidence to influence and make change happen, both locally and nationally. There are a number of ways in which the Life Changes Trust has already shared learning in relation to the evidence here today, and in how it will continue to do so going forward. Early last year, we decided that it was important to shine more of a light on the work taking place in communities in response to COVID-19. And so we began to produce regular flash reports to highlight the work of communities in keeping people safe and connected. In July 2020, the flash report highlighted the work of Evanton Wood and how it had adapted its support in light of restrictions. Not long after, we hosted a number of online sessions with projects to listen more about their experiences of COVID-19. From this, the COVID-19 Learning Report was developed and has been used several times as a means to influence change at a national and at a local level. One project is mentioned in the report called Joy to the Moment. They take the outdoors indoors, with anyone wanting to get involved invited to record themselves doing something creative outdoors, giving the film specifically to share with people who stay indoors, shielding in their own homes or in their rooms in care homes. This is a much needed support for people and very much has helped people feel connected to communities and what's happening there. The films are available on YouTube and we can certainly give you details about them. The Get Outdoors evaluation and the accompanying summaries from each project is what we are highlighting today. The report is one way to share evidence of impact, and as you can see already, we have worked with projects and outside the box to look at other ways to share learning with the use of animations and also the film you have seen and the films you're about to see. All of this sits on our website and is openly accessible to anyone who wants to use it. And finally, in early November, we developed a vision to a whole life approach to social care in Scotland. The report draws on our evidence base, including what we have heard today, and focuses on what we see as the key areas for improvement in adult social care in Scotland. We hope to amplify the views and voices of thousands of people living with dementia and unpaid carers, many of whom have responded to this review in their own right. The final review of the Independent Review of Adult Social Care is expected in the next few weeks, and all of these reports can be found on the Life Changes Trust website, in our publications page, and also in our dementia programme page as well. And last, but by no means least, in June 2020, we published Dementia, A Whole Life Approach, a resource for creating better lives. This is a 500-page box set of valuable learning and information for people with dementia, unpaid carers of people with dementia, and anyone working in the area of dementia. This box set outlines the work funded by the Trust and the learning drawn from it, as well as that from other organisations in the field of dementia. This is currently on our website and is now being reviewed to include updated information from projects, including today's event and the reports from outside the box. We do anticipate and will be printing hard copies of this resource, so keep an eye out for our e-bulletin for further details on this. As well as it being hosted on our website, we are now developing an e-bulletin to complement the updates that I've mentioned, and will publish the e-bulletin regularly to draw attention to the changes in the current resource and any additions it may need. This is already proving to be an essential resource in the work taking place to influence local and national dementia policy and practice, as well as providing much needed information to people and communities who seek it.